Hi, everyone, and thank you for joining this Facebook Live broadcast. I'm Allison Johnson at Windsor Regional Hospital, and I'm joined today by Dr. Natalie Malice, who is the medical director here of the ICU. Hi, Dr. Malice.
Good morning, Allison.
And I'm also joined by June Muir. She is the CEO at the Unemployed Help Center in Windsor, and she's one of the first people in our region who tested positive for COVID. Good morning, June.
Good morning, Allison.
This is Coping with COVID. It's a new series of live conversations about COVID-19. Today, we're going to talk about the physical impact of the virus. We're going to talk virus. And if you have any questions for our guests throughout, please post them in the comment section below so that we can include them in today's discussion. But first, I have a question for you. So imagine that you've been diagnosed with a life-altering illness. What is the first thing that you're going to do? After the initial shock wears off, how many of you said you're going to Google this? Raise your hands. You're going to start researching. You're going to want to know, what is happening to me? Will I be okay? And what can I expect in terms of treatment and recovery? For those diagnosed with COVID-19, though, it's not that easy, right? A year ago, COVID-19, it wasn't even a thing. And today we're still learning about the impact of this virus and how to best treat it. Now, June Muir, when I talked to you earlier, you said that COVID-19 is a very lonely experience, and that's why you wanted to be here today to share your experience so others won't feel so alone. So can you describe that experience and talk about that feeling of loneliness going through it?
Absolutely, Allison. So on March 9th, when I returned from New York, I began to feel ill. I was in denial. I thought, I've got a flu, I've got a cold. It couldn't possibly be COVID. I was going through it and had no one to turn to ask questions, as I didn't know anyone that had maybe COVID at the time. It was so new. So I went for my test. I got that positive result. I cried when I got it. I was devastated. I didn't know what to expect. I felt alone. I didn't know who to turn to. And it was a very terrifying experience. We really didn't know much back then. So I was able to, reach out to my family doctor. I could ask questions, but still there wasn't a lot of information.
And June is one of the reasons, she is the reason that we're doing this today, because she reached out to us and shared that experience with us, that, because of the information is changing so quickly and there aren't any other people out in the community to talk to about this, that we should really get something going. So thank you for this idea, and thank you for being here today with us. Talk a little bit about how you felt back in March when you first got the virus.
Yes. So I started off with unexplained fatigue. I had an eye infection. I had the chills, and then I got a headache, and I started to cough. My cough was severe, and it got worse as time went on. And then I was having difficulties breathing. I finally went for the test. I was afraid to go for the test, I have to be honest. And really, the test was not as bad as I thought. And I thought, why did I prolong it? So by the time I found out that I did have COVID, I had already experienced a lot of the symptoms. And I knew to stay home. And the only one I gave it to was my poor husband. And he's diabetic, and he was extremely ill. We had to separate. I had to go into a different bedroom. So I was already feeling alone, and then I had to separate from him. And he was extremely ill as well. And I was trying to help him. And we just didn't know what to do. He was dehydrated. He had diarrhea. He didn't want to go to the hospital because he didn't want to be alone. He didn't want to leave me. And I felt guilty about not sending him there because I knew that I should have called that ambulance, but I didn't. So we were very fortunate. We made it through the journey, but it's something I'll never forget. And I'm reminded of it on a daily basis when I listen to the news.
For sure. Well, thank you again for being with us today. And I want to bring Dr. Malice into the conversation now. Since the start of the pandemic, really close to 200 people have been admitted to Windsor Regional Hospital with COVID-19. And Dr. Malice and her team, they're on the front lines in the ICU where they see some of the sickest patients. And Dr. Malice, we're talking about a virus that a year ago, again, we knew nothing about. And people who have it, they can have no symptoms at all. or they can be on life support. So before we get into the questions of what we don't know and what we don't know, how steep has this learning curve been for you and your team?
Well, Allison, the learning curve was extremely steep. When COVID came out, we were getting information. I mean, we were hearing about it from overseas and things like that. And we were thinking, what are we going to do when it comes, not if it comes, but when it comes to North America and to Ontario and to Windsor? Our learning curve was steep in terms of there were so many facets to look at it from, whether it was the medical aspects, how do you treat this thing? What do you do? And, there's all the intricate details of how do you treat this thing? Is it different on life support? Do you treat it differently? To, an infection control standpoint, how do you run, the usual procedures that we do? Do we have to change how we manage those procedures? Is the infrastructure in the ICU and in the hospital in general adequate to protect the staff, the patients, everybody around us, the families from this disease? And so, that, and then all the flow procedures, and what are we going to do if we, explode in terms of numbers like they did in some areas, like in Spain and in Italy? Are we going to have enough capacity? We had to increase capacity. I mean, it was just very, very overwhelming, on top of having to deal with the usual crazy busyness of the usual hospital business, right? So it was, hours in meetings and hours on, hours in meetings and hours in, on the phone and on email and reading and things like that. I seem to have lost you. Hello?
Are you there?
I think so, but I can't find us. Oh, there we are. Sorry.
That's all right. So basically, a steep learning curve. Where are we at now in terms of that? Is the information still coming as fast and furious, or?
Yeah, I mean, it's not as fast and furious. I think it's settled, but there's still a lot of information coming and differing things that we need to still sort through. So for example, information about vaccinations, information about treatments that comes and goes. And then a lot of people are publishing things early, and then it's not necessarily, the tried and true types of studies that we're used to. So because people are anxious to get treatments, out there and things like that, they're publishing articles kind of maybe sooner than they, before the peer reviews and things like that. And so then we, as the people at the bottom, have to kind of sort through all of this information and say, well, are we going to change our practice right now based on this little tidbit of information that 2 weeks later might be polar opposite? And so, we have to make decisions like that.
Now, June was talking about, there are so many different symptoms for this virus. And she was talking about, her husband felt that maybe it was time to go to the hospital, but they made the decision that it wasn't the right time for him. I have a question from Linda Jones, who sent us a question by email, and she wants to know, when a person receives a positive test, what is the next step for them, and at what point should they go to the hospital?
So that's a good question. I think that when a person receives a positive test, the most important thing is for them to isolate themselves from their families, which is unfortunate, but that's, I think, the most important thing in terms of protecting your family. So making sure you stay in your own room, try if you can to use, a separate bathroom if possible. Make sure there's a lot of hand washing, mask wearing, even within the house. Wiping down surfaces frequently in order to try to prevent spreading it, if possible, amongst your family. Stay indoors. Don't go out to the shopping center or to the grocery store. Have deliveries made to your house, etc. In terms of going to the hospital, it's a little bit more of a tricky situation, insofar as, you don't need to go in just because you're positive, but if you have symptoms that would require you to, have additional assistance, whether, if you're feeling very, very short of breath and you feel like you're feeling unwell, or if you feel like you're dehydrated and you can't keep up with your fluids. Those are some reasons that you might want to come to the hospital. But not everybody with COVID needs to be admitted to the hospital. Many patients can look after themselves at home. It's really a decision that you have to make, knowing your own body and knowing how you feel.
And now, June, you mentioned that you had a bit of symptoms different than your husband's. Can you talk a little bit about what you were experiencing in those early days?
Yes, I had a severe cough and I had difficulties breathing. And as time went on, I started to develop heart palpitations, and then I lost hair. So our symptoms were much different. And I'm a long hauler, where Bill is not. He might have been sick at the time, but it seems like I've been left with more side effects from the virus.
Natalie, what is the experience like when someone comes into the hospital? What should they expect?
I think it depends on how sick they are. I think that, if somebody comes in and they're either known to be positive for COVID or suspected to be positive for COVID, or exhibiting symptoms of COVID-19, they will be isolated. They will be asked to wear a mask, if not already. And I would urge people that if they are coming to the hospital, they should come with a mask on already. They will be isolated in a room. They'll be tested. They'll probably have some blood work done. They'll have a general assessment done. And then depending on whether they need to be admitted or not, they'll be assessed in the emergency room initially. If they need to be admitted, then a decision will be made in terms of how sick they are and which area they'll need to be admitted to, depending on what their medical problem is. The one thing that we've all struggled with when patients are admitted, whether they have COVID or not, is the isolation that, June, you talked about the isolation yourself at home, feeling kind of alone, and then having to separate from your husband in the house. So we see that also in the hospital in general, because we've had to limit the number of visitors coming to the hospital just to decrease the throughput in the hospital and reduce the risk of transmission and stuff like that. Which, we went from, in the ICU, I can speak to the fact that we went from very liberal visitation to very, very strict lockdown. And actually, in the height of the pandemic, we actually had no visitors allowed. And now we've kind of loosened up a little bit, but it's still quite strict compared to what we're used to. So, because we have to be strict with visitation, we've explored other options. So we've purchased iPads. We've actually had iPads donated from people in the community to try to improve the communication of patients with families and, the healthcare team with families. Sometimes we have to have difficult conversations on a FaceTime call, which is not really, that was very, very difficult for us, let alone for the families who had to be on the other end of that discussion. We've managed to kind of loosen up a little bit on some of those restrictions, but they're still fairly strict. In terms of what a patient can expect, it really would depend on what their medical needs are. They may need an IV, they may need oxygen, they may be asked to prone themselves, which means proning means, flipping themselves onto their stomach if their breathing is an issue. So we have patients on who have COVID pneumonia, so when it affects your lungs, and patients who are on the acute care floor, so not quite in the ICU yet, but on the floors, if they're requiring increasing oxygen amounts, we may ask them to flip onto their bellies, for example, so that increases the amount of, it helps the oxygen kind of flow better through the lungs. If they're in the ICU, then it's because they need higher level of attention at that point. They may be requiring much more oxygen. They may be, some of them may be on life support. If they're on life support, they would be sedated, etc. So, I don't know if that answers your question.
I think it's a range, is what you're saying, depending on. And I do want to bring in another voice to this conversation now. I want to introduce Victor Winter. He was one of the first people admitted into the Met Campus ICU back in March. And I had the opportunity to speak with him as he was getting ready to leave after 6 weeks about his experience.
I remember yellow angels coming. The other thing I remember listening to is the quiet zip of zippers. Yeah, my name is Victor Winter. I've lived in this house now for a little under 6 weeks. I'm a COVID-19 survivor, and this is the day I get to go home. I'm thrilled about it. It's been an experience, clearly life-changing, and I survived it. I don't remember coming here. I don't remember spending 3 weeks on ventilators. I don't remember when the doctors made a last-ditch effort to save my life. Don't remember any of that. But I remember being welcomed back here by a wonderful staff. Regarding COVID-19, be careful. I mean, all of these messages that are being put out there, they're deadly serious. They're deadly serious. This is something. I was a perfectly healthy specimen. I've never been in a hospital for illness in my life. And it had me out, completely out within days, and at death's door a few days after that. Yeah, I will now think more carefully about what it is that happens in these walls. What does it take to run a hospital? What does it take out of the guts of people, their spirits, their hearts? What do they give up to be here? Especially this floor. This is 4 North, and it's a place where a lot of desperate people are. Their lives in danger, at risk, and people willing to put their own lives at risk to get the work done. Yeah, it's remarkable.
We do have some questions from people on Facebook. I want to go to one from Judy Gerber. She is a liver transplant recipient from back in June 2018. Judy, thanks for the question. She wants to know the success and recovery rate for transplant recipients and how susceptible are we through community contact and what kind of precautions should we take? Natalie, is that one you can address?
Sure. So we know that, the way COVID affects people depends on a myriad of things, and we don't really understand how it affects certain groups and why it affects some groups more than others, and why some people get off scotch-free and are asymptomatic, and other people, other healthy people even are on life support and die, because I've seen a range of, it's not just sick people, or people who have comorbidities who get really sick and get on life support. I treated, people who were previously healthy and who were on life support and died. It's a very terrible experience. But in terms of answering your question, I think that there are certain groups of people who have a higher risk of acquiring the disease, or who, if they got affected by the disease, have a risk of a worse outcome with that disease. And certainly people who have like underlying heart disease or lung disease, high blood pressure, diabetes, obesity, liver disease, and then those who are immunocompromised. So people who've had a transplant like yourself, or even people who are undergoing chemotherapy or who are on some immunosuppressant medications, they would be at higher risk of acquiring it, and even at higher risk of having worsening symptoms from the disease. In terms of prevention, though, it's the same. It's the same all around. You gotta be extremely cautious, wash your hands, wear a mask, maintain social distancing when possible. That's what I would say that's very important. And when I'm hoping when the vaccine comes out, make sure that you get vaccinated, because that's the only way we're really going to reduce the number of infections.
Absolutely. And a follow-up question from Judy. She wants to know, what is the risk of contracting COVID-19 through the community? So how risky is it basically to go to the grocery store or out to the mall?
So I think, the risk waxes and wanes. I think that right now we are seeing an increased rise within the community. Does that mean it's not safe to go to the mall? I think, again, if you take the precautions, you wear a mask, you wash your hands, you don't touch your face, you maintain some distancing, you're not in a big crowd of people, I think it's probably safe, but everybody has to kind of feel comfortable with their own, everybody knows their own risks and knows their own comfort level and has to kind of be comfortable doing what they think is right as well.
And we've all made changes, or we've all adapted based on, like you said, our comfort level. June, you lead an organization in the city. How have you taken your experience and brought that with you into the environment that you're in as a leader in your organization and in the community?
So we've put a lot of procedures in place. We have a plan, and we made sure that when we brought everybody back, that we explained the expectation. We have essential service workers here in our food bank. So we provide a mask, hand sanitizer, we've got arrows, we've got, like I said, a really good plan, because for me, I wanted to make sure that the staff felt safe, and knowing what I had been through, I didn't want any of them to catch the virus. So we're doing all we can to protect them.
I have a question from Maxine Del Snyder. Thanks, Maxine, for sending the question. She wants to know, she heard some blood types are not as susceptible to catching the virus as others. Is this true? Dr. Malice, do we know?
So there's conflicting evidence. We know that there have been some studies that have looked that if you're an O blood type, that you are less susceptible to contracting the virus, and if you're of the B or AB blood type, that you're more susceptible. We know that if you do get it, whether you're O or A or AB or whatever it is, it doesn't make a difference in terms of what your outcomes are going to be. So you can be just as sick if you're O versus AB if you contract the virus. I don't think that makes a big difference in terms of how you're going to approach it. You're still going to approach it that just because I'm O, it doesn't mean that I can go around not wearing a mask and not, being frivolous in terms of my actions. You still have to be cautious and wear a mask and have your social distancing and wash your hands, because at the end of the day, it doesn't matter what blood type you are, you can still get it.
That's interesting. June, you mentioned that you've been going through this for 8 months now, or this happened to you 8 months ago. How are you feeling now?
So I'm feeling a lot better. I've been exercising, eating healthy, taking vitamins, but I'm not 100%, Allison. I still have heart palpitations. I'm still losing my hair, and I have chronic fatigue syndrome. But I am getting better. So there is light at the end of the tunnel. And Bill has that chronic fatigue syndrome as well, but he's getting better. But I can't say we're 100%. And I don't know when we ever will feel like ourselves again. And I guess that's my question is, when will I be me again?
That sounds like a frustrating experience. And I want to throw that over to Dr. Malice. But before, I think there's another question on a similar note that we received from Danielle Lalonde. And she says, I am 8 weeks post onset of symptoms. I had a moderate case that didn't require hospitalization. I went from walking and hiking up to 34 kilometers a day to being told not to exercise at all, because every time I exert myself, I seem to have a relapse of symptoms. I'm wondering, what can I do to help myself improve? I am currently going for a walk every day, but trying not to overexert myself. I'm ensuring good sleep and taking vitamin D, zinc, and C. I would like to know what the protocol is for professional athletes who we see get back on their feet so quickly. You have. And I would like to continue to exercise and get back to where I was eventually. She wants to know, is this even possible?
So those are all very good questions. I think that, we know, and what we've seen is that everybody behaves differently with this disease, unfortunately. We have some people who are completely asymptomatic. We have some people who have a mild case, who don't have to be hospitalized, like yourself, June, and then still have symptoms that are drawn out. And we're still learning a lot about this disease. There's still, new people are coming up with symptoms that, are kind of out of nowhere, and they're like, oh, well, it's probably from the COVID that you had from a month ago or 2 months ago, and so I think that the important thing in terms of getting back your exercise tolerance and things like that is doing what you're doing, walking, and listening to your body, and you want to push yourself, but not to the point where you're going to hurt yourself. I think that if you're still having symptoms, you can be assessed by your primary healthcare provider, who might be able to run some more tests, breathing tests or X-rays or CAT scans if needed, because sometimes it's a virus, and so viruses can kind of bring out other things like asthma or other complications, and so that's something that I can't really address here in this forum, but it's something that you can definitely talk to your family physician or your primary care provider about, to maybe look into in a little bit more detail. But I would encourage you to not stay still, keep walking, stay active, and then, lots of fluids, rest if you need it, things like that.
Dr. Malice, you mentioned something interesting there about how wide-ranging these symptoms can be. Do you get questions from people like with just random symptoms, because it can be anything. So I've experienced a rash. Do I need to worry? Or I have a tickle in the back of my throat. Do I need to worry? I think we're all a little bit sensitive to that right now.
Absolutely. And I think common sense has to prevail. So if you have a tickle in your throat and nothing else, and you're not feeling sick, it's probably just a tickle in your throat. But we have to be cautious. So for me, like if I have a tickle in my throat, I'm hypervigilant, and I kind of look at that and I say, oh, do I have any other symptoms? Do I have a headache, a fever, a cough? Have I lost my taste of my sense of taste and smell? We all have to be hypervigilant in this time. But we also, common sense has to prevail. I don't think that we can have a mass panic because we have a symptom of a rash that is probably just a rash of sorts. There's got to be common sense there.
It's finding that right balance. In June, I'm guessing that having gone through this once, you might be a little sensitive to this as well when you either are experiencing things or seeing other people.
Absolutely. And fingers crossed that I can never get it again, but there's no assurance to that. And that's my biggest fear. I have a lot of anxiety about that because I definitely don't want to get it again.
And Dr. Malice, what do we know about the chances of that happening?
So we're still learning, is the first thing I want to say. But we do know that there are people in the world who have had it twice. And we don't know if it's because there's a second strain of coronavirus that's going around where they've now had the second strain, or if it's an immunity issue. So maybe they had COVID the first time, they either didn't mount an immune response, or they did, but it's worn off and now they've got it again. I mean, when we talk about vaccinations, the data isn't out yet in terms of how long the vaccine is going to last in terms of its effectiveness. But my personal bias is I think it's going to likely need revaccination similar to the flu vaccine, which is an annual thing. I don't know. I'm not saying it's going to be an annual thing. I'm saying that I don't think it's going to have lifelong immunity like some of the other vaccines that are out there. We know right now that in some of the studies that have come out that they measure the level of antibodies, and by roughly 2 to 3 months, those antibodies are down. Now, we also know that some people mount a big immune response and some people don't. And that's, the factors of that are dependent on how strong is your immune system in mounting a response? How badly did you get COVID in the first place? So, for example, somebody who is asymptomatic probably won't mount the same response as somebody who is has full-blown COVID. And so there's so many variables out there that we don't know exactly how long you're immune for. So it goes back to the same beginning that we've talked about. Wash your hands, wear a mask, social distance, all of those usual basic things.
A question from Christina Rakis. She says, once the vaccine becomes available, will it be indicated for pregnant and breastfeeding women or infants? And is this something that we even know right
It's a good question. I don't know the answer for sure. I know that they're doing trials right now. I don't know if they've included pregnant people in those trials and babies. And there's always questions as to, are certain medications or vaccinations safe in pregnancy? So that I think is yet to be determined.
We're living through this, right, in real time and figuring it out as we go along, and lucky to have all these people working around the world to keep us safe and find the best way to treat it. But it is definitely interesting times and things are changing. Carolee Walters wants to know, can one get COVID-19 again once they are negative and symptom-free? I think we may have touched on that one a bit already, but
so the answer is, again, in the literature, there are case studies that have shown that people have had it again. And so I would say that the answer is probably so.
And a question from Darlene. She wants to know, if somebody had cancer, should they be working in a high-risk environment?
I think that, each person has to look at what their risk factors are, both environmentally as well as with regards to their own health, and make a decision. I would encourage you probably to speak to your primary healthcare provider, who would know more of the details of your personal health and what your environment looks like to make that decision.
A question from Dave Flynn. He wants to know, how many COVID cases are there now? And I won't put either of you on the spot for that, because I'm told that total up to date, we've had 3,139 locally. So June, that takes me back to you. There were probably maybe a handful when you were diagnosed back then. Unfortunately, as things unfold, that number continues to grow. Does it make it easier when there are more people that you can talk to and connect with, even if they don't have all the answers, but just to have somebody who understands what that experience is like?
Absolutely, Allison. So I'm hoping after today that we can connect, and through the email that you've provided, if someone has a question for me, I will be able to help them share some of my experience with them if need be. And also, it's been a great opportunity today to hear from Dr. Malice, and I absolutely learned a lot. And because we've had several months, it's been 9 months for me, more information has become available. But when I had it on March 9th, when I started with symptoms, there was no information. So totally different from then until now. But I just really want to be there for people, because I know exactly how it felt for me and how lonely it was. So that's why it's so important for me to be part of this today and approach David and get this happening.
And our guest today, Dr. Natalie Malice from the ICU at Windsor Regional Hospital, and June Muir, one of the first confirmed cases of COVID in the city. They're here with us for another few minutes. If you have any questions for them, this is your opportunity to ask. We do have a comment from Mario Oliverio, who says, thank you guys for everything. And I think that that's thanks to both of you for being here today. And also thanks for all of the healthcare workers, right, who have been working since, well, all year. This has been a crazy year to keep everybody safe and healthy and informed. So I think that that's a big part. June, a question for you, because you mentioned you and your husband are going through this and your family can't come to help you, right? Like when you're sick, that's what you think that you would do. You'd go help your mom, your dad, your cousin, your brother. But you guys have to be in isolation at that point. What can family members do, or what is the best way to support somebody who is going through this?
Mm-hmm. So Bill and I were very fortunate. Our family and friends brought food to the door. When you're sick, you cannot prepare a meal. So we had a number of meals dropped at the door, and that's exactly what you can do for a friend or a family member. Also, I needed, certain items like Tylenol, a thermometer. Family members would run to the drugstore, leave it on our porch. My pharmacist was excellent. I would call her. She would get something delivered to the door. So you need that help because you can't go out. You are isolated. And a phone call just to say, how are you doing? I know that one day a friend called me and I was trying to get Bill's temp down, and I just said to her, I can't deal with this anymore. I'm losing it. And she helped me. She talked me down. Yes, you can deal with it, because you're going through it and you just feel, like I said, so alone. So we got through it, and I just want to be able to help others.
Well, thank you for doing that, for sure. I'm sure this is a big help. Before we wrap up today's conversation, I do have one more question for both of you, and I just want to kind of open it up and ask, what is the message that you want to get out there to our community as we all try and figure out what is the best way to cope in the midst of this global pandemic together? And Dr. Malice, why don't we start with you?
I think my message to everybody right now is to not be complacent. I know it's hard. I know that we've been doing this for 9 months now. It's very difficult for everyone. There's social isolation. There's, people are kind of sick of hearing about COVID. They're sick of having to wear masks. They're sick of not being allowed to do what they normally do. I haven't seen my parents in a year. They don't live in Windsor, and I haven't seen them, and it's horrible, but I haven't. And unfortunately, that's where we are right now. We are seeing a rising number of cases provincially, locally, and now we're starting to see more and more cases coming into the hospital. So we know that this is just the tip of the iceberg. We know that we lag behind Toronto. The last wave that we had, we were lagging behind Toronto, and we're lagging behind the GTA right now too. So the GTA right now is exploding. They're having increasing number of cases, increasing number of hospitalizations and ICU cases, to the point where there's concern that we're not going to be able to look after the people who have non-COVID illnesses, the heart attacks, the kidney failure, the stroke. So I think that the message that I have to our population here is to not be complacent. Keep social distancing, keep wearing a mask. I know it's hard, but it's so important. And I'm hoping that when a vaccine comes out, that we will be able to kind of loosen up some of these restrictions. So, yeah.
And hopefully that's part of what we accomplish today too, because like you said at the beginning, we don't have all the answers. We want to provide as much as we can, but I hope that through sharing this information and having these conversations, it is a reminder to people that we are still in the thick of this, and we have to continue to be safe. And you're right, it's tough as time goes on to continue to be vigilant. June, I want to throw it over to you now. What message do you want to leave people with today?
To definitely follow the guidelines. And I echo Dr. Malice's comments, but I also want to ask people not to judge people that have had COVID, and to not be afraid of them. And if you're a person that has COVID, or you've been through COVID, don't be afraid to share your experience. Don't be afraid that you're going to be judged. And if you need help, reach out for it. It's out there.
I think that is great advice. This is a 6-part series. So before we go, I want to remind everybody, we're going to be back here next week. We're going to be talking about the impact that this virus has on our mental health. We covered a lot of ground today on the physical impact, but I'm sure, June, you will agree that this virus is as much mental as it is physical. And the mental health aspect is something that a lot of people are experiencing right now. We're also going to hear from Heidi Robinson. Her husband, Tori, is a nurse over in Michigan, and he spent more than 5 months in hospital due to COVID-19.
I said bye to him through the plastic clear. I said bye to him through the plastic clear spot on the window, and then I was not able to visit him until May 30th. So 2 full months, and it was really, really bad. It was weird being at home, and I mean, some days would go by, I didn't even change my clothes, and I would always just look for updates from the hospital, and I prayed a lot. Some days were very, very dark. Some days I cried so much I couldn't even think straight. I just couldn't believe it was happening to us. And I felt so bad for him. him being out of it and on all those drugs that kept him sedated while he was on the ventilator. So right now we just, day by day, happy with any little progress that Tori makes, and I stay positive and always letting him know how good he's doing and what a miracle he is, because he really is a miracle. And just helping him along the way.
So that's the conversation that we'll have next Wednesday here on Facebook Live. Again, same time, right at noon. A couple last comments from people who joined us today. Heidi Buckner says, this has been very informative. Thank you for your time. And Ranjit Singh, proud of the healthcare workers. God bless. Absolutely. Dr. Malice, June, thank you for your time today. June will be back with us next week to share some more from her story. And I want to thank everybody who joined us today for this important conversation. Also echo what the commenter said there. Thank you to everybody who is working in the healthcare field or outside of the healthcare field, doing their part to keep the community safe as we figure out how to cope with COVID together. So again, thanks everyone. Thank you to our guests, and stay safe, everybody. Cheers.
Thanks for having us.
Thank you, Allison, David, and team, and Dr. Malice.